Good afternoon, everybody. Today is Monday, December the 7th, 2020. I want to be updating you on COVID-19. In Alberta, we have 68,566 cases, 615 deaths. British Columbia has 36,132 cases, 492 deaths. Manitoba has 19,131 cases, 407 deaths. New Brunswick has 536 cases, 7 deaths. Newfoundland and Labrador has 351 cases, 4 deaths. Nova Scotia has 1,376 cases, 65 deaths. Ontario has 12,009,234 cases, 3,798 deaths. Prince Edward Island has 84 cases, 0 deaths. Quebec has 15,003,176 cases, 7,277 deaths. Saskatchewan has 10,412 cases, 60 deaths total. Northwest Territory has 15 cases, 0 deaths. Nunavut has 219 cases, 0 deaths. And Yukon has 54 cases and 1 death total. So those are the cases that we have across Canada. Now we're going to be moving on talking about Alberta and the cases, because every day our cases are going high and increasing every single day, and it's very shocking for Albertans to live that kind of a fear. So I'm going to be reading the Alberta cases today. So everything you need to know about COVID-19 in Alberta, Monday, December 7th. The latest, Alberta reported 1,836 new cases on Sunday, one day after breaking the record with 1,879 cases. Alberta positive rate was listed at 7.8% on Sunday. The positive rate in the province previously reached 10.5% on Friday, something Dr. Dina Hinshaw called a grim milestone. Alberta now has 19,484 active cases, an increase from Saturday number of 18,806 cases. So the thing is, we are getting cases now in Alberta like crazy and in our provinces. It's very important that everybody does their best by protecting their health. I'm saying that because it's very important that people don't understand that their health is at risk. Their health is at risk, and it's very important that you have to follow the health guidelines as much as you can, right? Because at the end of the day, we have to do all what we can at the end of the day to make sure that our health and our safety is really important, and that's something that's supposed to be coming first, and everybody needs to do the right thing at the end of the day, because it will be too late to deal with any kind of issue if we do not deal with it from the beginning. If we do not protect ourselves, if we do not do what's right at the end of the day, there's going to be harm to this. So we need to, the Alberta government needs to wake up, right? Yes, vaccines are coming around the corner. We're also going to talk about the vaccine because it came soon. Alberta reported 1,836 new cases on Sunday, one day after breaking the record with 18,079 cases. Speaking during a press conference held Friday, Dr. Dina Hinshaw, Alberta Chief Medical Health Officer, said the province has reached a grim milestone as Alberta positive rate reached to 10.5%. The University of Calgary Olympic overall Calgary potential has capacity of 375 patients. The University of Alberta Butterdome Edmonton potential capacity of 288 patients. The Civil Community Support Center Edmonton potential capacity of 375 patients. Deaths per day from COVID-19 in Alberta. Here is the regional breakdown of active cases reported on Sunday. Calgary zone has 7,288, up from 6,951 reported on Saturday. Edmonton zone has 8,963, up from 8,777. North zone has 187, up from 135. South Zone has 642, up from 610. Central Zone has 1,391, up from 1,340. Unknown has 113, up from 93. What you need to know today in Canada. At 7:30 a.m. Eastern on Monday, Canada COVID-19 count stood up from 41,005,182 with 73,379 of those cases considered active. A CBC News tally of deaths based on provincial report regional health information and CBC reporting stood at 12,665 cases. Ontario has reported more than 1,900 COVID-19 cases 2 days in a row with a new single-day high of 1,925 cases. Health officials in Quebec on Monday reported 1,577 new cases of COVID-19 and 22 additional deaths. Quebec, which has seen more COVID-19 cases and deaths than any other provinces, was dealing with even higher hospitalization numbers than Ontario. To the west, health officials in Manitoba reported 3,325 new cases of COVID-19 and additional 12 additional deaths on Monday, taking the provincial death total to 407. The 5-day test positive rate stands at 13.7% provincial-wide. There are 310 people in hospital with COVID-19 and 39 of those in intensive care. More than 4,000 cases previously listed as active were confirmed to recover after the province worked to catch up with a week-long data backlog that did not track all record cases, said Chief Provincial Public Health Officer Dr. Brent Rose. In British Columbia, which doesn't public report COVID-19 figure on weekends, health officials are facing an outbreak, and according to the local health authority, 8 people have tested positive at a site and testing of the animals is underway. Across the north, Nunavut reported 3 new cases of COVID-19 on Monday, all of them in Everett, located along the west coast of Hudson Bay, has been the worst hit by the pandemic since the territory reported its first case in November. Health officials in the Yukon and the Northwest Territories had not yet provided an update on Monday. And these are all the cases that we know across the provinces and across the territories also. So, Alberta is the worst 4-day of the COVID-19 pandemic in Alberta. Dr. Dina Hinshaw will update the province effort to protect public health today. The Chief Medical Officer of Health will host a news conference at 3:30 p.m. Mountain Time, which will be carried here live. 4 straight days, Alberta has reported that 1,800 new cases, with 1,836 on Sunday and 1,879 on Saturday, taking the number of active cases in Alberta to 19,484. During the stretch, 54 additional deaths were reported, bringing the total to 615. Currently, 601 people are in the hospital, and with 100 of them in the ICU. It has been 10 days since Premier Jason Kenney announced the most recent health restrictions, which closed high schools and banned indoor social gathering. At the time, Kenney warned more severe restrictions would be introduced if the spread did not slow. So these are the cases that we have, but we're going to be reading yesterday's cases that was shocked to me of Sunday's cases. I don't know if it's around. After announcing a previous new record for new cases, which was on Thursday, Alberta Chief Medical Health Officer said she was very concerned about these numbers. A man and a man and a woman in their 70s died from the disease on December 2nd in the Edmonton zone. A woman in her 80s in the Calgary zone died on December 4th. Her death is linked to the outbreak at Mountain Royal, Riva. Another woman in her 60s died on the same day in the Edmonton zone. Her death linked to the outbreak at a Valley Murgers. Another man in his 80s died from a disease in the South Zone. Here is the regional breakdown. Active cases. Calgary has 6,951. Edmonton has 877. North Zone has no. Edmonton has 8,777. North Zone has 1,035. South Zone has 615. Central Zone has 1,340. And Unknown has 93. So it's very important that the health and the restrictions of the government, we take it very seriously in every way because at the end of the day, it's very important that we protect our health as much as we can and making sure that the COVID cases doesn't affect us in every way. Vaccines are around the corner. Already today, the federal government announced that there will be vaccine coming as early as next week. That is just a government announced today. That's what Trudeau government announced today that there will be vaccine coming next week. For us getting it in Alberta, our premier said last week that we might get the vaccine by January, or that's the earliest we're going to be get it, but it will be taking time for it to be distributed and to do all that, right? So the vaccine is coming now. Everybody knows that that answer is answered, and it's very important that that this COVID hopefully life will go normal after this vaccine comes, right? Because there's so many vaccines that Canada signed up with. First of all, there was Moderna, the vaccine, the first vaccine that was being signed up with, and then there was Oxford, and there's another one today the federal government announced. Those vaccines are really important. They're gonna come next week. That's what the federal government said, and it will continue to come and provide across the provinces and territories by January 2021. So hopefully by February or March, the whole country should have a vaccine. That's the prediction of the federal government. Jason Kenney is on the right track to with the vaccine by saying that it will arrive in January. It can be either middle of January or end of January. We don't know exactly when it will be. It's either going to be beginning of January or end of January, but also the prediction of the federal government with the provincial government is the same level. We might not get it right away in January, so let's be hopeful that the vaccine, like again, the vaccine is not going to cure everybody, so people shouldn't be so mystic because of the vaccine. It will control the numbers, but it might not cure everybody. It's like people are going to die because of it, and there's people that are going to be taking it, and that all it depends at the end of the day. There's people that are going to live from it and able to live from the vaccine, and there's going to be the people that are not. So also I said that I'm going to make a decision about our school and about our lockdown, right? So next Friday, not this Friday, a week from now, the following Friday, there will be a decision that I will be making about the vaccine and also about what decision I made for how long the lockdown it will be, because the lockdown it can go until February, like I said, or it can go till January. But according, if we get the vaccine by January, and let's say the whole Canada gets it by January or February, then we're gonna open the schools again by February. Hopefully, that's my hope. But if we are not going to, but I will provide more information on December 18th, 2020, and that will be next Friday. I will give details information about how that will play out and what's the plan and how these vaccines are going to be distributed, right? Not just distributed, but also how the schools are going to be handling this, right? Especially my school, how it's going to be handling this, right? If we're going to be remaining of shutdown or not. Also, I'm going to give restrictions, like I said, that your cameras have to be on, that you have to show up on time. All these restrictions that I will be giving that day also, right? Having camera, making sure I might ask you verbal questions about anything. So these restrictions are gonna come into effect on December 18th. That's not this Friday coming, the last Friday before we go for our Christmas break. So that Friday I will be announcing about our school restrictions, and also I will be announcing about if the government has anything new. It depends, because the vaccine already, the federal government already announcing next week will come, and that's the last week before the break of the winter holidays. Officially, still, even if the vaccine comes, um, again, the Christmas and the New Year's is not going to be at the time to enjoy, because it's still um, still like people can get sick, and that will be really sad, right? Still people can get sick and all that. And like I said, the vaccine is not gonna solve every problem. It's not gonna heal everybody or make everybody uh, uh, get better or do anything. So at the end of the day, it depends on what the government, what it does and what it finds it. But at the end of the day, like I said, the vaccine is not gonna cure everybody. It's not gonna make everybody get healed or cured. So we have to know that that's the limits at the end of the day. We have to watch out what happens, and what's going to happen about this vaccine at the end of the day, because we don't know if it's going to be curing everybody or not. It's going to be curing everybody, because at the end of the day, it's progress, and what happens at the end of the day, right? So we will see, and I'll be updating you every day about the COVID numbers. But our numbers now in Alberta are super duper high, because our premier didn't want to do anything, didn't want to close down, and did not want to thing, right? Vaccine is coming around the corner, but again, we shouldn't say just because vaccine's coming, uh, we can do whatever we want now, and vaccine's gonna come, right? Like I said, vaccine is not something that is going to make the numbers go down, or is not going to make this COVID cases get little. So all that, it won't matter at the end. What matters is we have to protect ourselves. What matters is we have to do what we can, because at the end of the day, it's not the vaccine that's going to help us at the end of the day. It's not going to help everybody. I'm not saying the vaccine is not going to help people. It will help people, but it's not going to help every single body. There's people that are still going to die from it, and there's people that are not going to still be cured from it, and there's people that are going to still have the COVID cases. So we have to know that that's the plan, that's the future, but we have to know that, right? Because there's people out there that still don't want to listen, they don't want to follow the health guidelines, they don't want to help follow the health rules, and there's going to be consequence for those people also. So at the end of the day, what matters is our health matters, but also what matters is we have to do what we can by protecting our health and taking it very seriously in every way, because if we don't, there's no coming back in a way on it, right? If we want to go back, we all want to go back to life normal, but for that to happen, we have to protect ourselves. Especially now numbers are high, that tells you a lot of people out there are not listening, are not following the rules. That's what it tells you out there. Because people following the rules, our numbers will not be high. And besides, it's the government's fault too, because the government should have done lockdown last week. Even to this week is supposed to be on a lockdown, but our premier is waiting until the last week before the Christmas break, and he's announcing new restrictions next Tuesday, December the 15th. That same week, I'm announcing new restrictions and I'm coming up with a plan for the school. That same week, he's announcing the new restrictions for Alberta, and those restrictions better be a lockdown, right? Because if he does a lockdown, although vaccines coming now, it will be good for our province. It will be good for everybody if he does a lockdown immediately right now before it gets too late. But if he waits until it gets long, then we don't know how things are going to be by that time. So it's better for him he does lockdown down before it's too late and he can't do nothing about it. Anyways, is there any questions that I did not answer, I did not talk about, or something that you want me really to go through about, right? Because today I updated a new unit, unit 1, and I want to be going through that unit 1 because there's a lot of work, right? We have a quiz that is going to be coming on Friday, December the 11th. That's this Friday coming. We have a quiz, and then you're going to have a unit exam that will be on next Tuesday, on December the December the 15th, the same day that Jason Kenney is announcing new restrictions. So we have a unit exam next Tuesday, and we have a quiz this Friday. So hopefully people are prepared for it, because every day if you study and put the time, it will be good. So today I covered lesson 1 and lesson 2 for unit 1. So I'm gonna be reading that for you, and I told you, and your homework is page 13 to page 29 for lesson 1, and for lesson 2 will be page 12 to page 13. So that's due today at 4:30 p.m. So make sure that you complete it by 4:30 p.m. today. So I'm gonna go now read lesson 1. Right, we're done with COVID news. I'm gonna be talking about lesson 1 and what you need to do for today's homework. So today's homework, you're gonna have lesson 1. I'm gonna read that, but you have also the workbook that I put it for module 1. You have workbook for unit 1 and unit 2 for English 30-2 is under module 1. So you can see it there in the Google Classroom under classwork. You can see that I posted that, so you can see that. So I'm gonna go to the first lesson, read it for you guys so you guys know what you want to do. So module 1 overview. All our experiences fuse into the personality, everything that happened to us in ingredients. So lesson 1, and then each module has at least 3 or 4 units, but this quarter we're just gonna be doing only one module, and we're gonna have a final exam in January that's gonna cover all 3 units. Okay, so we're gonna have a quiz this week on Friday coming. We have a unit exam coming next Tuesday, and then after the winter break, you're gonna have another quiz and another unit exam, maybe another 2 more quizzes and 2 more unit exams. I'm hoping. So that's the plan. So I'm gonna be going to, this is all introduction. You guys can read it if you want, but I want to go into the first lesson and read the first lesson so everybody knows what their homework is. So lesson 1, introduction. In this first English language arts lesson of 12 grades, students are introduced to important skills practice that continues throughout the year. Reading for textual details and the analysis of narrative structure. In this lesson, students examine the opening pages. Okay, so this is the standard. For homework, students independently read chapter 1, the autobiography of Malcolm X, and develop questions focus out how the structure of the text makes point clear. Convincing the engaged students also considered several potential prompts for their own personal thing. Then assessment, students learning as quick write. At the end of the lesson, students respond to the following prompt, citing textual evidence to support, analyze, and inference draw from the text. So you guys have to do all that. Then vocabulary. This is where I'm gonna be testing you on your quiz on Friday. And also your unit exam, you're gonna have full of quizzes. You won't have all this stuff. So make sure, because if you know these words, you know the assignment, you know the homework, you know everything about the whole lesson. So I will be testing you on all this stuff. So it's very important that you make sure that you know these vocabulary really well by Friday. You're also going to need them again for the unit exam, because the unit exam will be from lesson 1 all the way till lesson 14, and that will be next Tuesday. Your quiz is going to be from lesson 1 all the way to lesson 6. So you're going to need these so you don't forget them after the quiz. So the vocabulary, it will be disseminated, to sacrifice or spread widely as through sowing seed. Prevailed, to have been or proven superior in strength, power, or influence. Uncle Tom, a black person who is eager to win the approval of white people and willing to cooperate with them. So, and then you have more words. Distinction, strong disagreement or contention or quarrel disorder. And then flaring, shining or burning suddenly a brief. Funnel, to send something such as money to someone or something in usual and indirect or secret way. Permit, an official document that shows that a person is allowed to do or have something. So all these words you need to know because I will be testing you on this stuff. But let's see with the first activity, right? Um, So activity 1, beginning of the outline, the goals for the module and unit. Explain to the students that in this module they read, analyze, and write notification errors. In this first 2 units, students examine how authorities narratives is all about. I think I want to get to the real assignment. So I'm going to read a paragraph and you tell me how that goes. So how does the author structure the first paragraph of a text to communicate the setting and conflict of the text? The first paragraph. Engage the reader by starting in this middle, terrifying event. It established that Malcolm X and his family are the victims of persecution and racist treatment. Men surrounded his house, brandishing their shotguns and rifles, simply because his father is encouraging African Americans to return to Africa. The opening establishes a period of deep racism and that Malcolm X is about to be born into. How does the author introduce the character of Malcolm's father? In activity 4, explain to the students. So some students have a background story or central story. Based on these keywords, what elements should a personal narrative response promote include? So these are some examples. I'm going to read them. The word background shows that the essay can be about the student culture ethic, regional, physical, family, economic, ethic, background, or history. The student would have to explain and describe his/her background, so explanation and describe would be key part of the essay. The word story shows that the essay can be a personal story that defines or is important to the student. A story suggests that the essay may have characters, plot, and dialogue. The word central demonstrates that the story or background the student chooses must be very important or essential to his/her identity. This means that the essay must communicate the century of his background or story either through reflections or central idea. The word identity is an important keyword that shows that this essay must be about the student's identity or sense of self. The word incomplete is like a word central that shows that the story is so important that a student could not fully represent him/herself without telling it. Right? And then what do you want to communicate about yourself, right? And then again, this is example. So this is the homework. So I'm gonna be reading the first one. So we're gonna go through. No, we won't go through it. So I'm gonna say, um, and then the homework. Now I'm gonna read the homework lesson so everybody knows what's for homework today. Okay. So write a list of ideas that about how you respond to the following college interview questions. Remember to keep in mind your task purpose is the audience. As your considered response, you will practice responding to the interview question as the following lesson. What do you want to do after graduating high school? Also respond briefly in the writing the following prompt. Analyze how Skillco creates a smooth progression events at the beginning of her text. Use the lesson vocabulary wherever possible in your written response. Additional, continue to look at the appropriate text to accountability, independent reading, which you will begin reading to 12 to 13. So this is just preparing. But so Skillo, the reader, by going back by the time before she was born to explain the reason for her difference, why she and her sister did not look quite like others children. They did not look quite white either. Her great-grandfather was white and married full blonde Balbo. Skill explained that the white side of her family originally came to where the living to survey the land for the U.S. government and send Indian children thousands of miles away from their families. Including this information oriented the reader by helping clarify why Silco appearance, both white and Indian, is a significant issue for Silco to discuss. So, you read this and then make sure you answer. Silco began the essay by observing only that she looked different, without stating whether her experience of difference was positive or negative. In paragraph 2, she developed this observation by sharing that she sensed immediately that something about her appearance was not acceptable to some people, white and Indian. Part 2. In the contrast, some people, Silco's grandmother, Muth does not seem to care about, because Silco never saw grandmother express any signs of that strains Silco saw in any other people who judged her for the way she looked. So, Silco described of the view of the people and the old-time people, clarify the difference she experiences in the paragraph 2 based on how people view by her, highlighted the difference in the two worldviews. Values person appearance white the old-time people value person's behavior. Skillcrow why her appearance was not acceptable to some people, but her appearance did not matter to grandmother. Although Silco difference between the modern way and old-time behalf. Silco means that both ways of seeing the world exist in the present moment. The phase world may be here explains why Silco plans to refer the old-time people in the present tense as well as in the past. So that's what it is. And then now we're gonna go to listen to assignment. Listen to listen to. We're gonna be reading it. So the same thing. So again, this vocabulary here. I'm gonna read the vocabulary again. So no vocabulary for this one. This one is no vocabulary. Okay. Malcolm X makes many references in his belief changing in the future. He uses phrases such as my imagine of Africa at that time. I know now to indicate that there is early views of the world will change as he grows older. The story of Malcolm X's mother gives a number of important insights into his character. The long harassment of his family by the state welfare people, whose visits began to plant the seed of division in the minds of his family, shows how Malcolm X's negative opinion of American governments might have started It also demonstrates Malcolm X's deep love and compassion for his mother. He goes so far as to say that he is capable of killing a person who spoke badly about his mother. How does the first sentence of the text suggest the author's purpose? The first sentence of the text describes, so this is examples. So read chapter 2, Autobiography of Malcolm X, and develop this discussion. Questions focus on how to structure the text, convince and engaging. Prepare possibility answers for your discussion. Again, there's examples, and then there's the homework, and you do it. And then here is how things are going to be marked. So engage oriented. So narrative writing checklist. So this is a checklist about how your thing is going to be graded or marked. So it's very important that you really understand this and really take this very seriously and take this course really seriously in every way. Not take it as a joke, or it does not really matter at the end of the day, because understanding and knowing things is really important, and really is going to help you in any way and every way. So it's very important that you make sure you do what you can by understanding, by making sure what you read is making really a lot of sense, by not guessing, by not making up stories, by not doing none of that. It's very important that you do what you can at the end of the day, because at the end of the day, we do what we can, and then at the end of the day, what matters. But we have to do our best at the end of the day and do our part at the end of the day. That's very, very important. I encourage everybody to really protect their health, follow the health guidelines. Is very important, right? Like I said, COVID-19 numbers are really high in Alberta. I don't know what the Chief Medical Health Officer will provide today, but it's very important that you do what you can at the end of the day by protecting your health, by caring about your loved ones. That's what I'm saying. Vaccines are around the corner. Vaccines are going to come by next week. That's what Prime Minister Justin Trudeau announced today. And also, our premier, like I said, already announced is going to come by January. So more likely looking at a vaccine either by January or February to come. And like I said, I'll make a decision on December 18th to make a decision when we're going to go back, because I'm still thinking it will be September, but I might change that to February if the vaccine come earlier and if all Canadians get it by February. But if not all Canadians come by February, and if we do not get it by January or February, then I will not bother saying that we're gonna open schools on February, because all it depends. By next Friday, we will see what happens with the news and everything. But until then, our numbers are really high. Like I said, the vaccine is not going to do much, especially in a time that we're not in a lockdown. Other provinces, they really did lockdown. We're the only province that are really behind, and we didn't do any lockdown because our premier doesn't want to, and now we are paying this price because of this government. So in the end of the day, it's very important. Just because the government is not doing their job, that does not mean we shouldn't do our job also. We need to do our we need to protect ourselves. We have ideas, we have plans, we need to get to it, and we need to protect our health. That's what's really important, because if we don't do that, numbers are not just gonna go high like that. This has to take work. That we all have to be doing our part, because if one person not doing their part, there's gonna be a problem at the end of the day. And the government doesn't want to do anything. And if we are like the government, we don't want to do our part too. We can't expect the numbers suddenly is going to go down. These numbers we're hearing every single day, they're high numbers now. They're higher than Ontario. They're higher than Quebec. Quebec numbers and Ontario numbers are not higher than Alberta numbers anymore. That was before, when we were talking about that Quebec and Ontario numbers were higher when we started the COVID. But now we beat that, because this is the only government, and this is the only premier that does not want to do a lockdown. And also, there's only Alberta and Jason Kenney's government that does not want to do lockdown. But there was lockdown for Ontario second time. There was lockdown for Quebec. There was lockdown for all the other provinces. There was lockdown, but it's only Alberta that was the only province that there was no any lockdown, that there was nothing that was going on. And that's what's happening at the end of it, because at the end of the day, Jason Kenney government doesn't see it's really important. What he sees more important is his businesses and his faculties and all that. And then I don't even know by next Tuesday, December 15th, I don't even know what he's going to be announcing. He's saying he's going to announce new restrictions, but I hope those restrictions are restrictions of a lockdown, because that's what we need. Until the vaccine come in January, we need to be in a lockdown. But I don't think even he's going to do that, because he's not somebody who even wants to do another lockdown. That's what he really said last week or 2 weeks ago. He really said that he doesn't want to do lockdown. He doesn't want to aim to do lockdown. That's a big problem when it comes to this provincial government. Doesn't want to do lockdown. So I know next week when he announces on Tuesday, December the 15th, when he announces new restrictions, he's not going to call for a lockdown, because he doesn't see a lockdown is that important. He's not going to do that. He doesn't see it's important. That's how Jason Kenney's government see it at the end of the day. He don't see this lockdown is going to do anything. It's not going to save people's lives. It's not going to do anything. That's what this government sees it at. And for that case, these numbers are not going to go down until we get vaccine. Even if we go vaccine, we might even be the last province that our numbers are going to go really good. The provinces that I can see that are the numbers now maybe in the hundreds, but there's provinces that are going to start becoming way better now when the vaccine comes, because their numbers are way lesser than Alberta. So their numbers are going to go down first, and then our numbers are going to go down afterwards, because we have higher numbers than Ontario, than Quebec, than especially the provinces that are high population. And it's really embarrassing when you see Alberta is the first or the second province that has the highest COVID cases, when there is no high population, when we don't have a lot of people that living in that province. It's crazy when you see it that way. But we have to do what we can at the end of the day, and we have to protect ourselves, and we have to take that seriously. Because if we don't, doesn't matter, the vaccine comes, doesn't matter what we come, this will take forever to leave. So that's what I'm saying. I'm not trying to be negative here. I'm not trying to say there's no future in this province. Things are not going to get better. They will get better. But we have to do our part too. The vaccine will do its part by protecting us. But we have to do our part also by protecting ourselves. Because if we don't, the vaccine is not just going to do it, and we're just sitting back and we're not doing nothing about it. We have to do our part at the end, and we have to show that we care about other people. And like I said, if you don't care about yourself, at least care about others. That's what's really important. This whole time of the pandemic, I keep warning people, please, if you don't care about yourself, at least care about others, because the people out there that you have to know, everybody that you give COVID, you're paying the price for. You know? I understand everybody's tired because of the mask. I understand everybody's tired because of all that. But we have to do what's right, because this is health crisis. This is emergency. This is that your life is in danger when you go out every day. When you go outside, you have to know that your life is in danger. When you go to a shopping store, your life is in danger. I encourage everybody not to go out if you don't have to, because going out with no vaccine now, with nothing, you're gonna get the COVID. Until the vaccine comes, I don't encourage anybody to go out. Unless if you have to. If it's emergency, you go out. If it's not emergency, you stay home. That's what it is. Because if you don't follow the health rules and you go out and you go to any all these places, it's not right. I don't see it right. And it's enough already that everything's open, and it's not good enough, and still numbers are high. See, schools are open or closed. And it's been just 2 weeks now, or 1 week, that school has been closed, and still the numbers are increasing. So that tells you that these numbers are not going down. So that tells you that the schools are not part of this COVID, as not making those numbers go down. And the school is not some people, they accuse the school and saying the school is what making the numbers go down. We can see it now, a whole week that passed, and schools was closed from last Monday till Friday. We're going now into a second week, and then third week. And we will see, because he said already by the 15th, if numbers don't go down, he's going to do new restrictions. I don't know what those restrictions are going to be on December 15th, but I think those restrictions are not going to be strong restrictions like he announced this like the 2 weeks ago. Those restrictions are not going to be good restrictions, because the last two restrictions that our premier announced were not good enough. with the first restriction when he announced this was just recreation centers and sports, and that's all he announced. That's it. And bars. He announced the bars and recreation. That was the first restriction that we heard from the premier on at beginning of November. End of November, we heard a second restriction, and those restriction was closing the school for 3 weeks. Even worship places supposed to be 1/3, and that didn't happen. And he reduced the worship places and made it into 1/3. That was the restriction that we had on the November the 24th, and that was Tuesday. That was 1 week ago when we had that restriction. Then that was one of the restrictions. Casinos stayed open, everything else stayed open. People are not allowed to gather at home, but they can gather in casinos, they can gather in bars, all these nonsense stuff that we heard from the premier on November the 24th. And those restrictions, again, they were not good restrictions and they were not strong restrictions. They were silly. And we can see till today, the numbers are still increasing every day in Alberta. So that tells you the government wasn't even serious enough to do harsh restrictions to punish the people. Didn't do that. And now, see, now we are more than 18,000 a day. 19,000 we just got reported on the weekend. People in their 70s and their 80s, they're dying every day in intensive care and in hospital outbreaks. We heard it in the weekend, and in just past this weekend, we got like what? How much? We got 1,863 new cases in the weekend. We got 19 as a total province, 19,000. We're talking about late thousands now, as we're talking about cases in Alberta. We're not talking about hundreds or 100 or 200. Talking more than 19,000 cases a day in Alberta. That's very shocking. So that's the kind of cases we're hearing in Alberta now. This is why I'm saying our numbers are way higher than any other provinces in Canada. And instead of and on top of it, we are all over the news. We're in global, we're national, the whole country is watching us because our numbers are really high across the province, starting from Friday until today. And every single day numbers are increasing and we are all over the news, and it's really disappointing when you see government like us that doesn't want to take any responsibility for Albertans. As a government, it's your responsibility to make sure that the citizens' health is really important, to make sure that you protect people's citizens, to protect people's safety. It's not your businesses and your industry is more important to you than people's health. And that's what this government is doing. It's taking the citizens as a joke, and it's taking the businesses and everything else more serious. And businesses are suffering now because of the pandemic. It's not like the businesses are recovering during the time of pandemic and we have all these issues. Businesses are losing money. They're complaining to our Prime Minister. They're complaining to Jason Kenney. Businesses are losing here. Our federal government, I appreciate the federal government by giving support for Albertans and the whole country. But we have to do what we can at the end of the day by making sure that we protect our health. I hope everybody have a great day and see you on Tuesday.